Tricep dips. Tricep dips are an exercise that involves placing your hands on a ledge in a pronated position. The movement includes elevating the shoulders and scapula to lift and lower the body. It uses hinge and condylar joint actions involving the humerus, radius, and ulna. Push-ups. Push-ups strengthen the core and involve shoulder and scapular elevation and depression, with the hands in pronation. The up and down motion is a hinge movement, using the femur, tibia, fibula, humerus, radius, and ulna. Arm circles, shoulder strengthening. This strengthens the shoulders through the ball and socket joint, which allows circumduction. The main bones involved are the scapula and humerus. Lunges. Lunges use a hinge movement at the knee. Moving forward involves protraction. The bones involved are the femur, tibia, fibula, and patella. Squats. Squats involve a hinge movement at the knees and hips. You also lean slightly forward and may raise your arms in protraction. The bones involved are the femur, tibia, fibula, and patella. Wall sits. Wall sits use a hinge movement at the knees. The bones involved are the metatarsals, tibia, fibula, femur, and patella. High knees. High knees involve both gliding and hinge movements. Lifting the knee is protraction. Lowering it is retraction. The bones involved are the patella, fibula, tibia, femur, tarsals, metatarsals, and sometimes the phalanges. Russian twists. Russian twists use a pivot movement in the spine and a hinge movement at the knees. The bones involved are the vertebrae, femur, tibia, fibula, patella, humerus, ulna, and radius. Crunches. Crunches mainly involve spinal flexion, where your upper body curls toward your knees. If you twist during the movement, the spine also performs rotation. The arms do not use a pivot joint during a normal crunch. Bones involved: the vertebrae of the spine, pelvis, and the femur, tibia, and fibula for lower body stabilization. The humerus, radius, and ulna are not major contributors unless your arms are actively moving. Mountain climbers. Mountain climbers use hinge movement at the knee and dorsiflexion, plantar flexion at the ankle as your legs drive forward and back. Your shoulders also stabilize the body, creating slight gliding movement of the shoulder blades. When the knees lift toward your chest